Welcome to the Easy Baby Academy, your online source for expert pre- and postnatal education. Check out our courses at easybaby.co.za by clicking the link below.
Hi Louise, thank you so much for joining us this morning. So I'm just going to ask you if you can just tell us a little bit about who you are and what you do.
Thank you, Sam. My name is Louise Ashton, and this is my little girl Isla. She's 4 months old, and I'm a speech and language therapist, and I work mainly with deaf children whose parents want to follow an oral approach, so who want them to learn to speak, to listen and speak without using sign language.
Okay, that's something, and that's the reason we brought you in today, because I wanted to ask you, parents are very stressed that their kids aren't going to speak. So what can they do to make that happen? What can they do as an influence on their child to make them speak correctly and do it at the right time?
Okay, so there's sort of four building blocks when you have a little baby. Mm-hmm. And the first one is speaking to your child. Second one is reading. Mm-hmm. Third one is singing. And the fourth one is playing. Okay. And that covers all ages. It doesn't matter how old your baby is. So the first one is sort of the communication bit, is communicating with your baby. So it's looking to see when your baby has communicative intent. Yeah. So even before a baby can use words, they are already communicating with mommy and daddy right from the start. So in the beginning, it's just a little movement of the arm or a little movement of their legs, or the way they squeak or squeal or coo or start to babble. And that's all communication intent. And the more parents respond to that, the more the baby learns that what I'm saying is really important, and mommy and daddy likes that, so I'm going to do more of that. More of it.
And do they have to, people often have this question, do they have to speak in what we used to call baby language, or do you speak as you would speak to each other? Which way do we do it?
So what you're referring to is what we call motherese or parentese. It's where you use that, oh, hello baby, that type of language. And it's actually been found in research that it's good to use that type of language with your baby, because that catches their auditory attention. If you just speak the way you and I speak to them, or you and I speak, that's not really interesting sound. So it doesn't always capture their auditory attention.
It's more like a background noise to them.
Exactly. So when you speak using lots of intonation and making your voice high and low, they start to learn different patterns. It catches their auditory attention, you hold their attention longer, and auditory attention is one of the first building blocks for a baby to learn to listen, attend, and then start that whole communication process.
And can they differentiate voices so they can know this is mom, this is dad, this is stranger?
Yes. So from early, just after newborn, a baby, sort of in the first month, a baby can differentiate between mommy's voice and a stranger's voice. And they would respond quite quickly within the first 2 months to mommy and daddy's voices if they hear them without seeing them. So you can actually, if your baby's crying, start calming them before you get into the room by saying, mommy's coming, and they'll start to quiet.
I actually thought there was more for the mom's benefit.
They can actually, they might not understand obviously what you're saying, but it's that calming effect for them, or that soothing effect that my mummy heard me and she's
on her way.
So again, that's also communication. So you communicate with your baby even though you're not with them, and they start to learn that communication is a two-way thing. So that's also important when you speak to your baba, to leave lots of pauses and gaps. So you're sort of waiting for them and look at them with expectant sort of face.
So like waiting for them to answer you.
Exactly. And then it doesn't really matter what you say to them. So you can tell them about your day or what you're doing or where you're going. It's just the fact that you're talking to them and they're hearing the patterns and the rhythm that's associated with the home language. Yes. Because all babies are born with innate ability to learn any language in the world. Okay. But by the age of 12 months, they don't have the ability anymore to discriminate between all phonemes of all languages. That's only for the first 12 months that they can do that. So the more language input they have from a first language speaker in the first 12 months, the easier they will learn that language.
And then if parents have two languages within their household, what should they do? Should they only speak one? Should the one parent speak one? Like, what is the best way to get around that so that there's no confusion? I don't know if there is confusion, but if
there
there's
can be.
Yeah.
So it's sort of, we say one parent, one language.
Yes.
So if you've got an English dad at home and an Afrikaans mum at home, the Afrikaans mum should speak Afrikaans and the English dad should speak English.
Okay.
So the baby starts to associate the English with dad, Afrikaans with mum.
Yes.
But it means they start to also discriminate the phonemes for all those different languages. And in the beginning, it looks as if they've confused the languages, because they might look at one of their toys and say, they might just have the English word for that toy or the Afrikaans word for that toy, but they can understand both words in both English and Afrikaans. But their lexicon, when they start to speak, is just so small. So they will just say the one word for that. So it might look as if they're confused, but they're not really.
All right,
as long as parents just stick
to the one language.
Stick to the one language. Then that shouldn't be a problem.
Fine. Mm-hmm. Oh, stunning. And you mentioned singing. How does singing differentiate from talking?
So again, singing is different. You have different patterns and the rhythm and rhyme. So there's lots of singing similar to reading, has lots of rhythm, rhyme and repetition.
Okay.
And that is what babies really listen to.
Is that the point of nursery rhymes, that they're repetitive?
Yes.
Okay.
Yes, definitely. And that's how they also learn the patterns of sound and how sounds go together, and that there's pauses in different sounds, and they start to learn a little bit of word meaning from that. So we would often, with little babies, start to do a nursery rhyme and leave a little gap for them so that they start to fill in that gap. So if you sing,
so it fills it in their brain almost.
Yes, yes, and they can start to also fill it in verbally, even if it's just by doing a sound. So I would sometimes do something like row, row, row your boat, and you would go row, row, row your boat gently down the stream. If you see a crocodile, don't forget to scream, and then you sort of wait for the baby to go ah. So they learn that communication,
and they wait for their turn.
Yes, exactly. So it's sort of that early turn taking, just with nursery rhymes as well.
Yeah. And how does play fit into this?
So again, play is a building block for language, because you are talking about the toys that they are playing with.
Okay.
And the way you are playing with them, even from a very young age, again helps them to just make associations with the toys, and that everything has a name, for example. So by 4 months, babies can turn to their names. In 6 months, between 6 and 9 months, research showed us that they can understand common nouns that they hear all the time. So if you always say, do you want your bottle? And then give them the bottle, they start to associate bottle with the object. So if you're playing with them with a lot of different toys and you hook interesting sounds on the toy, so a ball that go bounce, 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 bounce. If you say, where's your bounce, 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 bounce? Between 6 and 9 months, they might start to look for their ball. So you're building that building block, and you teach language through playing with them. So it's informal. You don't have to ever sit a baby down and say, right,
we are going to learn our flashcards.
Ball, exactly. You don't have to do that. If you just play with your baby and name the things you're playing with and are interactive in playing, your baby's learning language.
Okay, so it doesn't have to be a formal thing, because I think that's what a lot of parents do, is they're like, when do I now start teaching language? You know, and so you're saying it's just a very informal, just be with them.
Yes,
and respond to them.
If you are just responsive to their communication intent, you'll find yourself doing automatically singing, reading a bit of books, and playing with them, and that's how they learn language. And a lot of parents are always concerned about the first word.
Yes.
Because that means my child
can speak. They've got a voice.
But actually, it takes about 12 months for a baby to listen and learn before they start to use their first words. So a lot of parents wait for that first word, but actually if you start to see how your baby is understanding you, so about sort of from 9 months to understand verbs. So if you say to them, can you clap, clap, clap? They might clap their hands. Or can you say bye, bye? They might start to wave. And that's such a good indication of your child is understanding. So understanding comes before spoken language.
So it's before. So because I often see that with the toddlers or whatever, you can give them an instruction and they'll follow that instruction.
Yes.
But yet they can't actually say any of the words of the instruction.
No, but that's
so that is right.
That's exactly how it should happen. They should show you understanding first, and then they sometimes would use a non-verbal thing, like if you say bye bye, they might just go like this, or say give it to me, they just might do this.
Yes.
So the ta and the tata or bye bye will come a little bit later, but that is the first indication that they're learning language. Because
that's
they're
stunning.
understanding you.
And parents often worry if their kids aren't babbling or talking. When is it a concern? Like, when should we say, okay, this child is actually not doing anything?
Yeah.
When should we seek help? That's our question.
Okay, so around about sort of 3 to 4 months, babies start to do a bit of single sounds, so ah or e, and they start to blow raspberries, or what we know as bubbles, that sound. So that's around about 4 months. 4 to 5 months, I would look for just single sounds and that sound. And then around about 7 to 8 months, between 7 and 9 months, you want to see them babble a little bit, like ba, 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 da, 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 ma, ma, ma. So it's repetitive consonant and a vowel sound. And if they're not doing that by 9 months, that's sort of an indication that I would think, I wonder if maybe just go and get their hearing checked.
Okay, is it more a hearing thing generally then? So it's like an auditory, they can't hear it. Okay.
That's most of the time. Yeah.
Okay.
Yes.
And then in terms of that, in the hospitals, they do hearing tests on day 2. Can they really pick up whether your baby's got a hearing deficit at that early age?
Yes, absolutely.
Okay.
So some hearing losses will get missed because if it's a very, very mild hearing loss, or sometimes if it's only a hearing loss in one ear, or if it's a progressive hearing loss, meaning it's time onset, then they might not pick it up. But for the majority of hearing losses, especially if it's a severe permanent hearing loss, absolutely pick it up.
So it's worth doing that test in the hospital?
Absolutely.
Okay.
The earlier you get intervention, the better.
The better.
So they will typically provide a child with hearing aids or help them to get a cochlear implant. And what that means is the hearing aid gives them the ability to hear sounds the same way you and I hear sound. Okay. So then the baby can start to hear things that we hear. So there's not a gap. Yeah. Because if you wait too long and you find out your baby has a hearing loss at age 8 or 9 months, it means they've missed 9 months of listening.
Yes.
So where other babies are already starting to understand wave, this baby needs to start from
9
day
months,
0, where they just listen for rhyme and intonation and pattern and different type of voices. So they've got a 9-month gap, which just keeps widening.
Yes.
So the earlier the better.
The earlier the better. Stunning. And then just the last question is, moms are so stressed about, or parents, not just moms, the parents are so stressed about things they may be causing problems. And should I use a dummy? What if they suck their hands? What if they, putting stuff in their mouth? Is it going to affect their speech and their orthodontics and their palate formation? Maybe if you can just chat a little bit around that, just to put us a little bit at ease. Make us feel less guilty about what we do.
No, definitely. Absolutely. So the oral phase in a baby is sort of between 0 and 12 months. And that is where they like to pick up a toy and put it in their mouth. That's how they explore, and that's how they learn how the dimensions of the thing and how it feels and how it all fits together. So the oral phase is fine. I wouldn't take it out of their mouths, unless, of course, it's a choking hazard. Yes. But for the majority of the time, let them explore, because that's how they like to explore. In terms of dummies and fingers in the mouth, it's not a lot you can do with the fingers in the mouth. Yeah. Sometimes they just keep doing that. The thing with the dummy, that's preferable, dummy is sometimes preferable to finger in the mouth, because you can come to an age where you can throw the dummy away, where the finger in the mouth sometimes and often leads to
thumb sucking,
which then leads to more problems down the line, especially in and articulation. So if you always have your finger in your mouth, your tongue and your palate isn't going to learn to move correctly. So some speech sounds might not sound the way it should sound. Where the dummy will do the same thing, unfortunately. Okay. So there is a time where I think a dummy is okay, because if you use it for a soothing mechanism, often babies like it, because again it's in that period where they want something in their mouth and that soothes them. Yeah. So I think a dummy, or even if they prefer something in their thumb, is fine, but it's up to an age where they really start to talk a lot. So I would say about 18 months you want to start getting rid of the thumb or the dummy, because it's going to influence how they pronounce some sounds.
Okay. And is there a palate change? And does that affect, or is that not really an issue? We read all of these things, and that's what we just trying to explore here.
Yeah, There can be,
Okay.
if it's something that you
Too
have
much.
in all day,
Okay.
every day long.
So it's again our moderation issue.
Exactly. It is sort of use the finger and use the dummy as a soothing tool.
Yeah.
So my suggestion to parents always, use the dummy to help your child go to bed, or if they're upset in the car, or if you know they are in a situation where they're not comfortable. Use the dummy, but then take it away so that they're not always just reaching for the dummy and put it in their mouth when they're bored.
Yes.
That they learn to play with toys and explore in other ways, that this doesn't become sort of
Yeah.
too much of a security.
So that dummy
net.
hanging out their mouth while they're exploring around.
Exactly. And by the time they start to speak, that dummy needs to be out, and you only then use the dummy when they maybe go to bed. Or
Okay.
if they're really upset, to calm them down.
Okay, stunning. Well, thank you so much for your time. And thank you, Isla. You were so good.
Well done.
Thanks so much.
Thank you so much for having me, Sam. Thank you.
If you enjoyed this episode, hit the subscribe button below. And remember to check out our pre- and postnatal education courses at easybaby.co.za. You got this.